As the Australian population is ageing, individuals affected by diabetes are also increasing. Hi everyone, my name is William and today we'll be discussing diabetes and the impact it may have on foot health, as well as the role of your podiatrist in dealing with this all too common ailment. It is commonly known that there are two types of diabetes, and regardless of which type one may suffer from, both can result in mild to significant complications in the feet. The main ways diabetes may affect the feet are firstly, impairing the blood vessels in the extremities, secondly, impairing the nerves in the extremities, and lastly, an increased risk of infection, whether it be fungal or bacterial. Essentially, diabetes are at a much greater risk of poor circulation, poor sensation, and infection. Due to these complications, diabetics are subsequently more at risk of developing foot infections, ulcers, foot deformities, and in extreme cases, even gangrene, and ultimately even amputations. So because of these risks to the health of the diabetic's foot, podiatrists play an integral role in the management of a diabetic patient's overall well-being. There are several ways podiatrists assist in the management of diabetic feet. Firstly, we are responsible for the monitoring of a patient's foot health. This includes assessment of a patient's foot circulation with the Doppler ultrasound, assessment of the patient's protective sensation using monofilament testing as well as vibration testing, as well as inspection of the patient's feet for signs of any other pathologies. The second way podiatrists can be involved in the management of diabetic feet is maintenance. Often, diabetics require ongoing care regarding their nails as well as their skin pathologies such as corns and calluses. Self-maintenance can sometimes be difficult or even dangerous due to the risk of self-harm, and our podiatrists are more than willing and ready to take over if need be. Diabetic patients should also be educated by their podiatrists on how to best monitor and maintain their foot health as well. The final way a podiatrist may be involved in the management of diabetic feet is in the unfortunate event there is complication to the feet due to diabetes, such as a foot ulcer, infection, or nail infection. Our podiatrists are all well equipped to deal with these complications and can prevent them from developing into more significant or serious complications. So the main points to take away from this are, if you're a diabetic, it is important to have your foot health regularly monitored by a professional, and if you are unfortunate enough to develop any problems with your feet, it is important to have them attended to by a professional. Quite often with diabetics, small problems can quickly develop into bigger problems. Chances are any issues or concerns you may have with your feet, we should be equipped to help deal with them. On a side note, diabetics are usually also entitled to a few visits a year to see podiatrists subsidised by Medicare under an enhanced primary care plan. You can speak to your GP to see if you qualify, which will help offset the cost for this important service for your foot health. So if you or anyone you know has questions regarding how we may be of assistance, please feel free to contact one of our friendly staff, and we are more than happy to discuss any concerns you may have. Thanks for listening, and as usual, we are here at your service if you need us. Thank you.